That second study tackles protein-losing enteropathy, or PLE, which is a syndrome in dogs often causing chronic diarrhea and characterized by excessive protein loss from the intestines, leading to low protein levels in the blood. It's considered a severe form of chronic enteropathy. This condition often carries a guarded prognosis. There's been a clinical impression that certain breeds might fare worse than others, specifically pugs, who are sometimes thought to respond less favorably to treatment, potentially relapsing quickly. The aim of this multi-center observational study, conducted across 7 veterinary referral hospitals in the United Kingdom, was to compare the survival times of pugs diagnosed with protein-losing enteropathy to those of other dog breeds with the same condition. They defined protein-losing enteropathy based on a gastrointestinal condition and a concurrently low serum albumin concentration, after ruling out other causes of protein loss like kidney or liver disease. The study included medical records from 47 pugs and 148 dogs of other breeds. They collected data including age, sex, weight, blood work parameters like total protein, albumin, globulin, neutrophil count, lymphocyte count, and cobalamin, or vitamin B12. Concentration, as well as histopathology results when available, and information on treatments. Statistical analysis, including Cox's proportional hazards regression, was used to determine factors associated with survival time.
The findings from that study on protein-losing enteropathy and breed differences were quite striking. They reported a significantly shorter median survival time for pugs compared to the group of other breeds. The median survival time for pugs was only 104 days, while for dogs of other breeds, it was 759 days. Statistically, this meant that the hazard of death was nearly double for pugs compared to the other dogs in the study. Beyond breed, the study also identified other factors influencing survival. A higher neutrophil count in the blood was associated with an increased risk of death. On the other hand, a higher concentration of cobalamin in the serum and the administration of cobalamin supplementation were positively associated with a decreased hazard of death. Interestingly, the serum albumin and globulin concentrations at the time of presentation didn't significantly differ between the pug group and the group of other breeds. However, serum cobalamin levels were actually higher in pugs, possibly because fewer pugs had levels below the laboratory's reference interval compared to the other breeds. The study also noted a complex time-dependent effect of serum globulin concentrations on survival, where higher globulin was associated with a higher risk of death after a certain period.
That significant difference in survival times highlights a potential breed predisposition or difference in disease severity, or treatment response for pugs with protein-losing enteropathy. The study suggests that this condition may indeed carry a worse prognosis for pugs compared to other breeds seen at these United Kingdom referral centers. Thank you for listening to the Veterinary Medicine Digest. If you're enjoying this, remember to like, share, and subscribe as proceeds from this channel go directly to providing vital veterinary care for animals in need.